my name is Kayla Glumack, and I was diagnosed with ulcerative colitis at the age of 13, so I've had this disease or chronic illness for about 15 years, coming up on 16 already. So most of the time it was pretty mild, you know, all my symptoms were under control by a pill form of a medication, but recently, about 2 years ago, my body just stopped responding to it, so now we've tried a couple different medications. First we tried Remicade infusions, and now we are on to Humira injections. So I've been on Humira for about 4 months, and I wanted to come on here, show you how I do the injection, and give you my tips and tricks so that you can be really successful on your first time doing it too. So before I was on Humira, or before even getting prescribed it, I was really nervous because I am one who is scared of needles. So whenever I get my blood drawn or an IV in, I can't look because I just, ugh. So if you're like me, no fear, it's not as bad as it seems to give yourself an injection, because that is the form of this medication, is you have to deliver it yourself via pen injection. So when Humira came out a few years ago, actually, scratch that, I don't know how long it's been out, but I do know that they reformulated it. So if you were on this medication a couple years ago, people told me that it was really painful. So I'm happy to tell you that now they've reformulated it and it does not hurt as much. I mean, you're giving yourself an injection, so you do feel a little bit of pain, but what I find is that it hurts when you first give it, and then it's like maybe a minute, and then it's fine. You go on about your day and there's no issues at all. So let's talk about the medication itself. So it's kind of an expensive medication, not kind of, it's an expensive medication, but there are programs out there to help you cut the cost. So there's one called Complete, and I don't remember if my insurance set this up or my doctor, but I'll leave the information down below too, so you can get information on this as well. But what's cool about that is, A, your insurance will either cover it up front and you'll just have a $5 copay, or B, you'll have to pay the copay up front, but then you'll get reimbursed. You just have to send in your receipt. So I was crossing my fingers for A for me, and it worked. I don't know why. My insurance just covers it, and then I just have to pay the $5 copay. So when you first get Humira, you have to do a starter kit, and basically you'll get 2 pens, and you have to do 2 injections the first week, and then 2 weeks later you'll do 1 injection, and that'll be kind of your pattern. So a lot of people do 1 pen every 2 weeks. So mine, now that I've still been flaring, I don't know. So we tested, little backstory. We tested my Humira levels and they were fine, but I started flaring again, so we are doing weekly now. So anyway, some people do a week, some people do every other week. Regardless. Okay, so this medication is refrigerated, so you have to be home either when it's delivered by mail, or if you have a pharmacy that is a specialty pharmacy, which I do, I happen to live really close to one, I just pick it up right there, so that's kind of nice too. You have to have it refrigerated, and I would recommend before giving the injection, you want to take it out of the fridge at least 30 minutes before. I actually just take it out the night before because it does last outside of the fridge for up to 14 days. So the night before, I have a little alarm that goes off on my phone saying your injection is tomorrow, so I just pull it out of the fridge and I put it in this case. I'll show you that because I have animals. I have a cat who likes to go on the countertops, and if he was to, like, you know, shove it off as cats do, it would not be good if the inside of that pen broke. So I'll show you that in a little second here. But yeah, so basically we're gonna walk through how to give the injection. I wanted to think if there's anything else that I wanted to tell you. It's not as scary as it seems. Oh, also too, so it's kind of nice because they'll actually set you up with a nurse ambassador who will help you with your first injections. Now, you can either do this in person. They told me that I have the option to have someone either come to my house, or I can meet them at the hospital or clinic, and they'll like walk you through it and actually show you how to do the injection, or you can do it over the phone. Now, I grew up with my best friend who has type 1 diabetes, so I watched her give herself injections of insulin, so I was kind of familiar with, you know, like what to do, like pinch the fatty part of your skin and get it ready and whatever. I thought I can just do it over the phone, and it worked out really fine for me. The nurse actually walked me through the whole thing, so it was really easy. So today, let's go ahead and go into the kitchen and get this injection on. It is refrigerated, so it's really important to keep it cold until you need it. So like I said before, the night before I will take it out of the fridge, and it comes in a box like this. You'll get 2 pens in a box. I already used one of them, so I just took the whole box out of the fridge and put it in this container. So basically what Humira comes with, you have a couple things in here. You got your alcohol swab, this is to clean the skin, and then you have your pen. So it is in this protective case, or not protective case, plastic case. And basically what you'll want to do is prep the area. So you can do your injection either in your stomach or in either one of your thighs. I always pick the stomach because I feel like it works better for me. So I just do that. So before we get the injection ready, we're gonna get the site ready. So I'm gonna pick my lower abdomen here. So I always like to pick more of like a fatty area. That's where you want to deliver it. So you'll want to pinch it and get a good area. So I'm gonna go right about here. So I'm just gonna clean this pretty good with the alcohol wipe. And then I do it, soon enough so that it has plenty of time to dry before we actually do the injection. So now I get everything open and ready to do. So you'll want to open this up. And your pen will look like this. It has two ends to it. They're actually numbered too. So you have 1 and 2. And the first thing that you'll want to do when you're opening this up is you want to check through this little see-through window. You can actually see my hand on the other side. And I always look to make sure that it is clear because the medication should be clear. No extra like particles or gunk going around. And you definitely do not want to inject this if the glass is broken and fragments are in there, because this is going into your skin again and you don't want that. So a couple other things about this pen is if you drop it, definitely check it to make sure that it has not broken. The other thing too is that it's pretty safe to deliver, and you can do it yourself or you can have somebody else help you. I find that it's easy enough to do it myself, so that's what I just have been doing since the beginning. Basically, you'll follow the steps. So we've prepped the skin, we picked our site. Let me see if there's anything else that I'm missing so far. I don't think so. Check the window, make sure that that's clear. What's gonna happen when you do this injection is there's a button underneath this purple cap. When you press and hold to deliver the medication, there's gonna be a little yellow lever that comes down and shows you that the injection is complete. Now, something that is a huge tip that happened to me on my first time delivering it is that sometimes that yellow lever comes down really fast and you think it's all the way done delivering the medication, but it's not. You wanna count to 10 and then release and make sure that you get all of the whole medication delivered, because if you release too soon, the medication will be on the outside of your body and not in, which is not good. So anyway, make sure you just do a full 10 count. I find that helps the most. So what you'll want to do is just hold this up. I hold it upright. I take number 1 off first. As you can see, it's kind of dripping a little bit. You do have the needle right on the inside there. And then I take off the second one. Now don't press that button until you're ready for it to be delivered. So what I kind of do is I hold my hand so that I can still see that little window, and you'll want to deliver it at a 90-degree angle. So right where I had cleaned that skin before, I'm going to pinch it up so that I have a good amount. I don't know if you can see what I'm doing. See how I have it kind of pinched? I'm going to press it into that skin, and then I breathe out and count as I deliver it. So it's a 10-second thing, so let's go. Okay, so it's about a 10 count, and all you have is one little poke. You might have a little tiny speck of blood, but that is it. I always prepare myself and think like, oh, it's gonna hurt so bad, and it really doesn't hurt that bad. So as you can see, I'm a little baby. But anyway, so one little spot of blood, no big deal. And that little yellow bar, this is what I was talking about, that comes down in the little mushroom window. That says that it's all complete and it was delivered effectively, so that is good. Now, to dispose of your sharps, because that is a needle in there, something that is nice, this plastic covering comes down after you deliver the injection, so it does cover the needle a little bit, but you want to dispose of it properly. With that complete app through Humira, let me go grab my little thing. They'll actually send you a sharps container, and then you just put this in there. So I just open this up. Put this in a sharps container and keep it out of reach of any children or pets. So I just keep it underneath our sink, locked away. And when it's full, it says that it gives you directions on how to reorder another sharps container, or I believe you can bring it to your local pharmacy too. So anyway, that is that. Not bad, just had one little kind of spot of blood, I guess. The other two things, like the caps and stuff, don't worry about trying to put the caps back on over the needle. Just discard the needle. You can toss these in the garbage and be done. And that is that for the injection. Easy enough. Basically what I've noticed, I don't really have any side effects from this medication. It is an immune suppressor, so that is going to mean that you can get illnesses a lot easier. I've been lucky so far to not catch anyone's cold or flu this season. but I'm just very mindful, and I do take extra vitamin C to just be really cautious. But anyway, side effects is what I was going to tell you too. So the only thing that I really notice is that on the injection site, after I deliver it, I feel like it kind of gets a little bit swollen for a little bit, and I think too, like all the medication being right there kind of like swells my belly up a little bit right there, and then that goes away after probably 30 minutes, so it's really not a big deal at all. So I can go back to wearing leggings and all of that and feel totally fine. So let me know if you have any questions at all. Thank you so much for watching. I hope you found this helpful, and if you're on Humira too, comment below and let me know how it's going for you, or if you're on a different medication for ulcerative colitis or Crohn's, let me know what's working for you. I am so happy to hear other people's journeys, and I found it really helpful for me, especially when I was going through my flares, to have somebody who has been through what I'm going through, and also if they are finding a medication that's working and how to use it. I am all about the research. So anyway, thank you so much for joining me today. I will be posting more videos about my ulcerative colitis story and other medications that I've tried as well. So definitely stick around for that. Be sure to like this video and hit subscribe. All right, thank you so much for watching, and we'll see you in the next one. Bye.